Children with asthma are getting better, faster, and cheaper care because of new coordination among Texas hospitals. To give you an idea of the potential impact, an estimated 25 million people in America have asthma. That's 1 in 12. They suffer shortness of breath after spasms seize their lower lungs. KXAN's Phil Prazen begins our in-depth look at the new policies for children's hospitals and what diseases might be next.
Asthma is the #1 reason for children to be hospitalized. It's the #1 reason for kids to miss school and for parents to subsequently miss work. Same care every single time. They get assessed in that first hour.
Assistant Medical Director of Dell Children's ER, Dr. Sujit Iyer, holds a piece of paper that studies show may save you time and money.
We do this whole thing every time.
It's now in the hands of most healthcare workers across Central Texas who work with children dealing with asthma.
So not only in the hospital, but community pediatricians.
It streamlines the workflow for healthcare workers so they're as efficient as possible. It's a big change from just a few years ago.
You usually have to meet like 5 people before you get to meet me, right? You got to meet the nurse who says, "What are you here for?" Then the nurse that's taking your vital signs, then the nurse that finally sees you in the room, then maybe another nurse who's taking your temperature, and then finally me. Okay. And all those times they're saying, "So what are you here for?"
Now, when a kid comes in with complications from asthma, they get an inhaler or steroids earlier in the process. The Children's Hospital Association of Texas says it's shortened hospital stays by half a day and dropped the need for chest x-rays by 25%, which can cost parents hundreds of dollars a pop. And ask anyone in the healthcare industry today, if something can save you time and money, it's worth doing. Phil Prazen, KXAN News.
Asthma is just the first of several diseases these children's hospitals are tackling together. Next on their list, 2 others that affect a lot of kids: septic shock and bronchiolitis. Those studies start next week.